I posted a couple of earlier videos about my immunotherapy. I do want to make one thing very clear. My cancer doctors have been excellent. They have been really professional, and I feel very caring and concerned with what I'm going through. Um, so there's no ill will towards them. It's the treatment that I'm having a problem with. One thing during this treatment that happened to me, the first side effect I got was joint pain. I couldn't, my hips, my arms, almost all my joints, like I had arthritis, could barely move, and they would seize up sometimes. And one day I was working, and my hips seized up, literally seized up. I went down on the ground. They had to call an ambulance, and I ended up in the emergency room. I was in so much pain. So when I'm in the emergency room, the emergency doctor wasn't really sure what to do with me, and I was in pain. I just help me with this pain. He goes, well, we can give you ketamine, and we'll give you a low dose of ketamine. And I'm like, now my wife, she objected to it at first. She objected, and I'm saying, Doc, I'll take it, whatever it takes. I need this. I need to get rid of this pain. It's just too, I don't know how, the pain was just unreal in my hips, my joints. So I kind of overrode my wife. So the doctor came in, the nurses gave me the ketamine. Next thing I know is I got this ringing in my ears. I'm out, gone. They said I had a bad episode. They said I stopped breathing. And it's kind of funny because I picture myself, I can see myself in my head standing outside my body, watching the nurse pull down my mask to check my breathing, and she's rubbing my chest like this on the sternum. When I woke up, that hurt. And then next thing I know is I wake up and I'm looking up at her and my chest hurts. So the ketamine that they gave me took away the pain, but what happened during the ketamine is scary. Now, this immunotherapy, for some people, I'm sure it's perfect. It's great. I've just had a lot of side effects on it for some reason. And I'm glad I'm getting the treatment I need. But the immunotherapy is kind of kicking my butt a little bit. Like I said in the earlier videos, it made me a type 1 diabetic now. Type 1 insulin. Got to check my sugar levels or glucose, whatever you want to call it. But I am grateful to the doctors. I am very grateful for my two doctors. My surgeon, my cancer doctor, and in fact, my diabetes, the doctor that's handling my diabetes, have all been great, fantastic. Why I'm going through this. Just the weight loss I'm a little concerned about. Now, I just checked my sugar levels. I'm at 523 right now. And then I gave myself some insulin. And I checked them this morning, when I got up this morning, and it was at 303. Now, my sugar levels are going up and down, up and down. Again, I'm not a diabetic, but they're treating my symptoms as if I am a diabetic. I guess I better make that clear too. But it's basically made me a type 1 diabetic on the immunotherapy. So here's some insight on what I'm going through with the immunotherapy. But I'm very grateful for the doctors. I'm very grateful for the immunotherapy. Without it, I'd probably be dead. So I'm grateful for the whole experience, but these are my side effects.